Ladies and gentlemen, welcome to today's podcast. My name is Parthosh Anand, and today we have the privilege to be sitting with one of the most prominent leaders in the country in the pediatric hematology, oncology, and bone marrow transplantation space. Dr. Sunil Bhat is the Vice Chairman, Oncology Collegium of the Narayana Health Group, and the Director and Clinical Head of the Pediatric Hematology, Oncology, and Bone Marrow Transplantation at Narayana Health City, Bengaluru. Recently, he has also been elected as the youngest ever chairperson of the Pediatric Hematology Oncology chapter of the India Academy of Pediatrics IAP, which honestly is a remarkable recognition for the kind of contribution he's had to the healthcare space in India. Under his leadership, Narayana Health City, Bengaluru has become Asia's largest bone marrow transplant center, with a 34-bed dedicated BMT unit equipped with HEPA-filtered rooms and is recognized for one of the highest volumes of successful pediatric bone marrow transplants. Dr. Bhatt's achievements are truly exceptional. In 2023 alone, he performed 215 bone marrow transplants, one of the highest numbers globally in a single year. Till date, he has successfully completed more than 2,500 bone marrow transplants. He also performs the highest number of matched sibling bone marrow transplants in India, and he's also conducted the highest number of transplants under the Coal India Thalassemia Bal Seva Yojana. Apart from that, he also performs the highest number of half-matched haplo-identical transplants in India. He has performed India's first ever haplo-identical bone marrow transplant on a 5-month-old baby using the country's first German TCR alpha-beta depletion kit. He is also among the first in India to initiate a CAR T-cell clinical trial for B-cell acute lymphoblastic leukemia. Beyond these numbers, Dr. Bhatt is also known for his philosophical soundness and for also giving 1,000 number of children a second chance at life. We're honored to have you today, Doctor. Welcome to the podcast. It's an honor to have you here. For someone who has, been in this industry for so long, for as much as old as I am, but it's wonderful to see. And it's wonderful to sit here to learn from people like you, to learn from the kind of experience and the expertise you've had. I have a very interesting set of questions here. I'm a very curious kid at heart. So, when I was told that I'm going to be interviewing a doctor who is this experienced in this particular field, I was very excited to sit and curate these questions for you. But I want to start with this, pediatric hematology, oncology, and bone marrow transplantation. What exactly inspired you choose this specific niche for yourself?
So first of all, thank you for having me for this conversation. And when you said as old as me, that makes me feel very, very old.
No, but you don't look. That's something I pointed out right in the beginning of this.
So I have a disclaimer. I'm not that old.
100%. Right. I am pretty sure for the people seeing this, they might see me as older than you. That I'm sure. But yeah.
So anyways, that's a compliment. So coming on to what you just asked, I trained as a pediatrician.
Right.
After doing a graduation, you have to choose a field. So I was quite interested in doing pediatrics.
Right.
And while doing pediatrics, I got a little bit, I would say, attached and interested in children who are suffering from blood disorders, malignancies, and it's, as you said, it's many years ago. It's almost 20 years ago.
Yeah.
And that time, in India, we were very primitive, if I may, in the context of how to manage the children and the avenues we had, opportunities we had to treat them.
Right.
So I think that was a kind of a spark which led to me, after I finished my pediatric training, to get into this. And I wanted to look after the children with blood disorders, cancers, because most of them are quite life-threatening.
Right.
They're chronic, means long-term, some of them for lifelong.
Right.
So that's how I think I, got interested in this and chose this as a...
That's very interesting when you say, because, that's exactly what I want to dig deeper into in this particular conversation that I'll have with you as well, because I want people to be aware that this is a real problem and there are solutions to this problem as well now.
That's correct.
But, being elected as the youngest chairperson of the Pediatric Hematology Oncology chapter of the IAP, it's a major milestone. What does that responsibility feel like?
So, we have come a long way. I think in pediatric hematology oncology community of India has come a long way. But having said that, there are huge gaps still. The gaps in the terms of the reach out we have as a community to the children which require our assistants reach out in the terms of affordability and availability of care for these children, approachability in the context of the geography of this care which is being provided. So most of these children and families have to travel long distances to get these treatments done, because most of it is focused in metros and tier 1 cities. And most importantly, the advocacy bit of it, right? So it's not a huge public health problem from the establishment point of view, but then it's a significant issue, a significant problem. So advocacy is also where I think we are lacking to a great extent. So organizations like the Pediatric Hematology Society or the IAP, which you just mentioned, is there, which has been there for decades now, and this is the organization which tries to bridge these gaps, reach out to the policymakers, reach out to the patients, reach out to the community, and being at the helm of it, which I would be doing for the next couple of years. I think there's a lot of responsibility, and I have made huge plans for executing some of the things which I have been thinking. Being youngest is just a coincidence. I think it's just that it just happened. But I think there are huge plans we have to make this to bridge this gap and make the things which we have thought of for the last so many years to make them happen.
That's wonderful. Does it make you feel pressurized though, this responsibility?
Yes, it's a huge responsibility, and you need to deliver because you have taken the faith of so many of the society members along with you, and that's a pressure, of course. But I think because there are people watching, there's accountability, but that also probably reflects into better performance, I would say.
100%. 100%. Narayana Health City is now Asia's largest BMT center. What do you think are a few factors that have played into the role of that success?
So first of all, I'm not very sure we're the largest in Asia. I think we are maybe one of the largest in Asia, because I don't think there is any information in the public domain where we can claim that. But having said that, yes, it has evolved into one of the large bone marrow transplant centers in India, and of course in Asia, and one of the largest in the world as well. It's not a thing which has happened suddenly overnight. It's a hard work which we all have put in for the last almost more than a decade.
Right.
A lot of factors have played a role. I think to start with, I think it has been the institution, the vision. Dr. Shetty, who's our chairman, has always had this vision of creating something big, always. And I think when I joined this place and I had a conversation with him, so the first thing he told me that, can we make this the biggest in India and biggest in the world? So that was the conversation when we started. So I think there has been a vision from the organization and from the establishment. So that's been, we got a very brand and very, I would say, one of the best infrastructures in the country, because these are, infrastructures play a huge role in delivering the care under bone marrow transplant. So that's been another advantage we had. But more important than that, it has been the personnel, it has been the people who have made this happen. And I'm so blessed that we have an amazing team of physicians, nurses, support staff, operation teams who have, over the period of time, helped us to build this. And of course, the leadership, which is very important. So there's been a dream, a vision, and I think everyone has played a role and contributed towards that.
It's very evident that you're very passionate about all of this, because, the certain sense of calmness that you have, the humbleness that you have with the way you're speaking, despite having so much knowledge about it, it's commendable. But, you mentioned infrastructure.
Right.
And, there are HEPA-filtered rooms. I hope I'm pronouncing it right.
Right.
There are HEPA-filtered rooms in this facility. Why do you feel they're critical to perform something like a bone marrow transplantation, for that sake?
Now, I'm not boasting, but, I think in my understanding, being a physician for, more than 20, 25 years now, is that I think the bone marrow transplant is the most complex treatment in medicine at this point.
Right.
We say heart transplants and kidney and liver and all that. I mean, they sound very dramatic. but it's a, I call it's a one-day game. Right? But bone marrow transplant is not a one-day game. It's a test match you have to play, right? It goes for a month, right? So in bone marrow transplant, the most important thing is to manage these patients for that much duration of time in the hospital in a very sterile environment, because these are patients who are heavily immunocompromised. A simple infection which you and me not even feel that anything has happened to us can be life-threatening for them. A simple cough cold, which we have every alternate day, few days, it can be life-threatening for them. So they have to be nursed, they have to be kept in very sterile environments. And that can happen only when you have these, what we call as HEPA-filtered, positive pressure, ventilated rooms with very strict infection control practices, one nursing. And that is the infrastructure which is required to manage those patients. And that's what, what you meant by HEPA-filtered rooms, actually that's set up.
Right. Okay.
Keep them in those sterile environments to protect them from infections during that phase.
So does that also ensure the safety and the quality of these operations? Because you're performing these operations in a very, very large volume.
Right.
Almost 215 transplants in a single year. It's a very big number, sir.
Right.
So does that also ensure this?
Yeah. So, as you mentioned earlier, and we are proud to be one of the largest pediatric bone marrow transplant centers in the world. We do more than 200 pediatric bone marrow transplants every year. And to my knowledge, there are not many, maybe 2 or 3 centers in the world who do, at one center, do more than 200 pediatric transplants. It's a large number to do. But that will only happen when your processes are in place.
Absolutely.
And processes are followed to the T, right? So we are a JC accredited hospital. We are a JC enterprise accredited hospital. So, and we have, we have invested hugely in protein processes, which starts from the journey of the patient even before they get into the transplant room, throughout the transplant room, and when they get discharged also for the follow-up. So there's process which is laid down. Everyone, plays their part. So that's something which is important and has helped. And, it's almost, we have been ensuring that the quality is maintained through this. We discuss every month what we call as quality parameters or clinical indicators. So we in transplant also have defined some indicators. We have a benchmark, which is the international benchmark, and we strive to be at par or even better than that benchmark, and that happens on a routine basis every month. So I think all these things are in place because large numbers should not mean poor quality. I think we should be able to deliver the best of the quality, even though the numbers are huge. But I think the quality is important to be delivered, and that's I think we really work hard towards that.
That's wonderful, sir. Thank you so much for watching the first episode of this podcast, ladies and gentlemen. I truly feel honored to be sitting here and interviewing Dr. Sunil Bhat, because honestly, he's one of the pioneers in this particular industry, and I hope you feel the same honor as well. Make sure you tune in for the second podcast episode, where we'll be dwelling deeper into the conversation that we're having with him about bone marrow transplant and Narayana Health City's infrastructure. I am very excited to see you in the second episode. See you.